And that is our special episode, The Front Line, on the fighting against the COVID-19. You're watching World Insight, still to come on the program. A Europe travel ban, virus testing woes, and battered stocks. The U.S. response to COVID-19. That's right up after this break. Welcome back. You're still watching World Insight. I'm Tian Wei. Let's turn to the United States, where over 400 new cases were reported as of Friday, bringing the national total to over 1,700. And though U.S. President Donald Trump remains calm and confident, at least apparently, there are questions and doubts over the U.S. ability to test for COVID-19. On Wednesday, Mr. Trump announced the restrictions to travel from many European countries, while places like Washington, D.C. and New York City have declared a state of emergency. Rising coronavirus fears have battered Wall Street, with Thursday's trading the worst since 1987 market crash. For more on the U.S. response to COVID-19, we are joined in New Haven, Xi Chen, an assistant professor at the Yale School of Public Health. In Atlanta via Skype, we have Carlos Del Rio, who is the Executive Associate Dean of the Emory University's School of Medicine at Grady Health System. Welcome to both of you. Professor Del Rio, tell me more about whether some of the most important measures have already been taken besides just travel ban regarding prevention and control so far.
You know, the United States, this public health in the United States is not centralized like it is in China and other countries. And the federal government can make recommendations, but really a lot of the decisions are taken at the state and local level. So you have to see that one of the challenges the U.S. has is we really don't have a national response, but you have state and local responses. Some of the states are taking very good measures already. They're putting in place social distancing, they're closing events, they're doing a lot of testing. Other states are not doing as well. So it really depends on where you are and what the situation is in that state and how much leadership the governor and the public health department are having in those cities, in those states.
Yeah, if I understand right, Professor Del Rio, there has been a lot of controversies between governors and also the federal government right now. And meanwhile, we understand the Senate is in recess, and while they are considering a bill whether to support the fight against COVID-19 on a national basis, it's likely to be 10 days away from now before they come back into their meeting room. So how would you interpret what is going on now? I would assume there were earlier crises. How did you guys figure that out? Will this time be figured out too? Because things are happening very fast. It's the virus we're talking about.
Well, correct. And I think, you know, let's look at what needs to be done. And what needs to be done is the United States has to very rapidly scale up testing. We have fallen behind, and that is not been good. So we need to do a lot more testing. We need to do case identification, and we need to prepare for social distancing and for other non-pharmacological measures. And I think, and we need to prepare our healthcare system to take care of the sick. So, you know, we have very good leadership in people like Dr. Anthony Fauci, who has tremendous experience. Yes. And I think Dr. Fauci is really, he talked to Congress yesterday, he testified, and I think he is really the person that I look as the leader in this response. And I would say that I'm hoping that Dr. Fauci will be able to mobilize the federal government and the state governments in ways that needed, because we have the resources and we have the expertise here in the United States. We just need to get everything coordinated and synchronized so we can start doing the work that needs to be done.
Dr. Fauci obviously is a very significant leader now, particularly when the others are not necessarily carrying out their responsibilities. Many believe, Mr. Chen, that in a fight against a virus, particularly an epidemic, now a pandemic, all parties have to be involved, and not just the health authorities. Otherwise, nothing can be done on a timely basis. Mr. Chen, what do you make of the U.S. realization of this? How about at local level? Can they do it on their own, at least to a certain extent?
Yes, as another panelist already mentioned, the U.S. is very much decentralized, not only for the healthcare sector, but also the economically. So now it's currently still very important to enforce social distancing, so it's necessary to cut down or reduce the social gatherings and try to suspend those activities. And those things will hurt the local economy very much. So, but no local government officials would like to be the first mover. So it's very important to have like a centralized or federal government to step in to put up front a stimulus package to stimulate some government to move first, then to try to persuade others to move towards the same direction. So that's very important, not only in the health, but economically. So I think also for the healthcare, besides healthcare sector, as we mentioned, a lot of American people are living on the subsistence social safety nets. So it's very important to take care of their basic interests. For example, the closure of the schools and the health insurance coverage. Those arrangements should be made at the federal level and the local official level.
Right. Professor Del Rio, if we look at some of the case studies already done in some countries which were in the fire earlier, China, of course, is one of those, but China is a huge country. If we look at South Korea or Singapore, for example, South Korea and Singapore, both private sector plays big role. South Korea particularly, but they have quickly centralized their system to fight against COVID-19 and be able to do tests on a huge basis and be able to come out of at least the current stage of crisis. Mr. Del Rio, I know there are a lot of talk in the U.S. also about what about the South Korean model. Do you think people will be able to really come to a conclusion and work on that? Or are we going to see more bureaucracy debates and political debate in the political year?
Well, you know, again, it's very hard. I mean, I don't predict the future. I'm not into that. That's not my specialty, right? You need to ask somebody who is in Las Vegas or something like that. But I don't do that. What I can tell you is what needs to be done. What needs to be done is, whether it's centralized or not, we need to have more testing. And today, I had the privilege here in Atlanta to speak to the private sector. We have very strong private sector in this city, all the way from Delta Airlines to CNN to UPS and many other big corporations, Home Depot in the city. So we need private sector to step in. We need educational institutions to step in. We have Georgia State, Georgia Tech, Emory University. And we need, the healthcare sector, we need all the different sectors to come together at the local, national, and state and national level to respond to this epidemic. And as Professor Chen said, we certainly can do it. There's a lot of things that need to happen. There's going to be economic pain. But if we don't do the right thing, the pain is going to be worse. So I'll give you an example. Here in Atlanta, we were hosting a major sport event called the Final Four, the basketball college finals. That brings millions of dollars to the city, and the officials from the NCAA, which is the organizing body, listened to a group of experts, including myself, and took the right decision, which is to cancel the game so as to not increase contagion. So we need the private sector, I think, when you speak to them and when you tell them what needs to be done, does the right thing. And I'm hopeful that the Americans will do the right thing because, again, you just need to lead the way, and we need to lead the way.
Testing has been a big issue. Professor Del Rio, you keep on talking about that, which is right to the point, because without testing, you will never know the statistics. Without the real statistic, or at least close to real, then you will never be able to find the right policy, contingent measures. So, Professor Chen, about that, there have been so much debate. Words are words, but still they're important, because whether it is a flu or whether it is COVID-19, this is a very crucial distinction. Earlier, people already counted back to last year about the deaths of flu and also the certain symptoms appeared on the lungs of some of those patients who passed away, and people wonder what really happened. Now, do you think on the one hand, the crisis management, emergency, about the medical support being done, but on the other hand, the research can go back and really look at what had happened?
Yeah, I would say it's very difficult now to go back to test those already deceased. So there's a lot of conspiracy theory going on, but I think this may do harm to the crisis management. But definitely when things come better, so it's very much important to go back and check what happened then. But so far, I would say the most important attention should be paid on the treating the patients. As you mentioned, it's still a flu season, so people should get their flu shot. That's very important to free up the medical resources to those really infected by the COVID-19. So this is something I think very important. And take Connecticut, where I live in, for example, and the flu shot rate is very low, and the testing rate and for the COVID-19 is still low. Only 90 tests was done in the last couple of days, very much in shortage, not only for Connecticut, but the surrounding states. So with knowing the real risk at the individual level, people can take necessary actions. They can isolate themselves from the others. I'm not worried too much about like population density. As long as people understand their risk, then they can take actions. They can avoid affecting others in a dangerous situation.
Right. Another thing about the resources, medical supplies, and also medical staff, hospitals. Mr. Del Rio, we all understand, given the earlier examples of China, South Korea, Italy, and many others, that it's very much going to be stretched, pressured, and all of a sudden, the number of cases would increase exponentially. So, do you think there could be at least sufficient amount of resources for the possibilities?
Well, no, I don't think there's sufficient amount of resources. I don't think, I've yet to see a country, you know, whether it's China or Korea, any other country that has been hit by this virus who has been able to cope with it, and everybody has been overwhelmed. And so to say that you have sufficient resources means you're not paying attention. So no, there's not sufficient resources, but I think again, we need to figure out what to do, and there's things, very specific things that healthcare systems can do to prepare for this. The difference between the advantage the U.S. has is that we know this is coming and it's not a crisis yet. So we have time to prepare for a crisis, and I think we don't have a lot of time, but we have some time. I tell people this is like preparing for a hurricane. You know, we know it's coming, it's going to hit us in a couple days. We don't know if it's a Category 4 hurricane or it's going to be a tropical storm. But we have to prepare for the worst and we have to hope for the best.
How are you, for example, in your school, preparing for the worst? If you can give some example. Are you also trying to help with the local hospitals? Is there alliance being built? How will the hospitals be supported by whom?
Many things. And in fact, we have Emory University has suspended classes. Emory University is actually the biggest provider of health care in the city. We own multiple hospitals. We partner with Grady Memorial Hospital, which is our city hospital. And we are doing everything we can to step up the support and to do what we need to do at those places. So yes, no, we are working very closely. In fact, I need to go soon to a meeting to talk with Grady about sort of surge capacity and what do we need to do. But at the hospital level, we need to do testing. We need to do, prepare for telehealth. We need to prepare to treat the patients. We need to prepare areas. So, for example, we're looking at some administrative areas in the hospital, turn them into patient care areas. There's a lot of work that needs to happen. It's really complicated.
Absolutely. You're talking in a faster speed. I can tell the urgency of the work that you are doing. Professor Chen, also to you, what needs to be done now to provide support even at the local level? Let's just give an example of your school and your colleagues.
Yeah, so far, like in Emory, also at Yale, we do not have too many hospital beds. If you look at the official statistics, in the last 10 years, the number of hospital beds per thousand population in the U.S. is declining as much as many other countries. Italy is even more prepared, I mean, in terms of per capita number of beds than the U.S. do. But still, Italy is in a deep crisis about this. So I think it's very important at a local level to act fast and act strong enough. So like us, we are, I think the healthcare system are preparing for people, like 5% of people may need ICU care. So this is very important to prepare the care facility for them. And also we are hosting town hall meetings to New Haven residents to make sure that they understand the risk and take necessary measures to protect themselves and their families.
I hope it's not too big a gathering, otherwise there could also be some potential danger in terms of the virus. But for now, I want to thank both of you, because I know you guys are working around the clock in order to save lives, to prepare to save lives at least. So thank you so much, and we hope in the future this platform we have established, which is called The Frontline, which is a special episode bringing Chinese medical workers and experts together with medical workers and experts from all over the world on the latest COVID-19, will also feature some of you on the program. Go ahead, sir.
I would also tell you that I want to thank, I mean, Chinese colleagues have a lot to teach us. They have produced a lot of articles. We've learned a lot of this disease. So I think this communication with China that has gone through this, China has a lot to teach the world about what to do and what not to do to get over this epidemic.
After all, this is a fight, united one, against the virus. Thank you so much, the two of you. Xi-Chen,
Absolutely.
Carlos Del Rio. Really
My
appreciate
pleasure.
it. All the best.
Pleasure.
And that is all the time we have for today. If you'd like to see more, try to find us World Insight CGTN. And also you can check out our YouTube channel, Twitter and Facebook accounts. I'm Tian Wei on behalf of the team. Thanks for watching.